Hi everyone, Dinesh Sarasena here, and today we're going to be talking about injections into the cervical facet joints. In my last video, I spoke about imaging the cervical facet joints, and when injecting, it's in the same position, so either having the patient sitting upright or in a side-lying position with the side that you want to inject exposed. When imaging and undertaking the injections, I usually use a broad linear transducer. The reason for this is that it gives me a wider field of view and I'm able to look at other structures, including the vasculature and nerves. When undertaking the injections, I typically use a 23 gauge needle. So this is a diagram of what you will typically see. Moving from posterior, you'll see the spinous process, you'll see the articular process of the inferior vertebrae, the articular process of the superior vertebrae, and the facet joint sitting in between. When undertaking the injection, I typically use a posterior approach, coming from the back of the patient's neck and aiming for the facet joint sitting slightly anteriorly. And here's an image of what you will see. So again, coming from posterior to anterior, you'll see the spinous process, the articular process of the inferior vertebrae, the articular process of the superior vertebrae, and the facet joint sitting in between. Then, introducing the needle from a posterior approach, you're aiming at an angle of approximately 30 to 45 degrees to try and get the needle as close to that facet joint as possible. Thanks for watching. I hope this video adds to your knowledge of musculoskeletal ultrasound imaging and interventions. If you did and you've got this far, please remember to hit the like down below and subscribe to the channel for further updates. You can also follow me on Twitter and Instagram, and remember to check out sportsmedinfo.sg. Thanks again, and I hope to see you all very soon.